Okay, let's take a look at the record room. I understand that there's some changes taking place with records in medical offices now.
For sure. Actually, you can come on in this way. And this area, when I first started practice in this facility, was all about records. Paper records, closed off from the flow of the patients. It used to house 2 more sliding cabinets as well as a couple of other fixed ones, and it's gotten smaller, and that's actually a great thing. The reason is that we've gone to a completely digital record, and that transition has occurred or started in 2010, in the fall of 2010, I believe, or 2009 actually, sorry, time flies. And as we've transitioned to a completely digital record, of course the paper records start to be phased out. The digital record is completely secure, it's backed up, encrypted. It includes every correspondence we have. In other words, we scan even the paper correspondence and emails into the patient chart, so we have no need anymore for any sort of paper record. The advantage for us has been complete freedom of time. We, as a team, spent endless hours looking for lost records, lost x-rays. Any dentist, any doctor would tell you that that's just a reality of practice when you have a paper record, and it's such a weight off your back to know that you can find everybody's record all the time.
And fast.
And quick, yes. The downside, like all of our lives, is when our technology goes down or we have a power outage, well, we're out of business for that time period. Backups are complete. There's not a risk in that respect. In fact, our licensing body mandates very specific protocols to have things really backed up and organized and private.
And it looks as if most practices are going this way.
I believe so. I mean,
easier to transfer files too, isn't it?
For sure. Yeah. Advent of digital radiography, digital X-ray, is probably the first part that really made it easy to transition. So.
Good.
If we move this way, just the last of our administrative area is a consultation room, which is kind of like a private office. It's a closed door room where more complicated treatment plans and treatment discussions can take place. It allows for patients to bring in a loved one that may also be part of the treatment decisions, particularly when things get outside of dental insurance benefits. Decisions have to be made from a financial perspective that can be quite significant. So it just allows a very comfortable environment to make those decisions.
And I imagine a lot of elderly patients don't really understand what they're getting into, and at least they can bring along a son or a daughter to have everything explained.
For sure, that's common, and certainly any teenagers, children, most of the time parents have to be involved, and quite frankly, spouses for the most part like to have some input from their spouse, and that in a lot of cases, particularly when it's, like I said, complicated treatment.
Yeah, it's not always fillings and pulling teeth. There's an awful lot of dental work now.
And even in some of the simpler things, sometimes you're very overwhelmed. I think as a patient, you can become overwhelmed with what was explained in an operatory, in the presence of a doctor, in the presence of a dentist, in the presence of a medical professional that sometimes is intimidating, and you don't always hear all of the details that are important. So it is nice to have this opportunity to revisit some of those details and to be able to listen and take some time to digest these things.
Great. So where to next?
So if we move into this area, we'll go through some of the equipment and technology that we have in the practice. This first area is this is called a Panorex X-ray. It's actually a digital X-ray machine that generates a complete view of the face and jaw components, all the teeth, the jaw joints. It also allows for some three-dimensional imaging to treatment plan implants and things like that, where anatomical structures become exceedingly important to keep in mind, obviously.
Is this a common piece of technology?
It's becoming more common. Most offices would have some sort of a Panorex machine, traditionally not a digital one, and traditionally not with some three-dimensional capabilities. The technology has continued to evolve to go to the next level, and that's the next area of upgrade for our offices, to get into the next generation of three-dimensional imaging.
Great.
The operatories, or the treatment rooms, are on the periphery of this section. We will go into one or two of them just to get a sense of what they look like and the comfort. This would be a typical hygiene treatment operatory, where it's a little more open, and clients, patients would come in for their hygiene visit with whether it's a new patient or their gum treatment, etc. So this would be kind of a traditional one.
I noticed that you got connecting rooms.
It works well in a hygiene setting. So oftentimes one parent might bring two children in at the same time, and one of the advantages to having multiple hygienists is being able to serve an entire family at one time. So people come at whatever time it is, 3 or 4 p.m., whenever they're convenient, and might bring 2 or 3 children, and be able to get all 3 of them serviced virtually at the same time, and sort of be in and out of here in an hour or so.
What a neat thought.
Yeah, it's worked out well. One of the other nice features that we included a few years ago from technology is the overhead video screens, which you'll see in every operatory. These actually they serve really 4 functions, but probably the best, most used function is the actual television. So they can play digital media, they can show the digital x-rays or any of the pictures that we take of the patient, and they can follow along in an exam process with cameras and so on. But really, when we play cable television, especially for children, whatever it is, Toon Network or so on, they basically are in their own zone, and it really makes their appointments go well.
Wow. So the old radio or tape playing is being replaced by the digigal.
For sure. I mean,
that's really neat.
When I started, CD players, Walkmans,
Yeah.
those kind of things. But this has worked out very well. So.
Very nice.
And it's very convenient. So we'll move. That's a good example of the hygiene rooms. We have a few others. We'll move into the central area here, which is our sterilization area. And the concept here was to keep it wide open, not to worry about contaminating anybody, but actually to show the flow and really feature it such that patients are comfortable with the processes that we put the instruments through. Everything from our sterilizers bank, our sort of area here where things are lubricated prior to sterilization. So the way this works is the dirty side is on this side. In other words, instruments come in from the treatment areas. They're either washed in an ultrasonic cleaner or this dishwasher, which is like a medical style dishwasher. Everything is enclosed in cassettes so that my team members are not, the potential injury for them is minimized. They're rinsed, and this is the wrapping lubrication station where certain things are lubricated, and then they're sterilized. And then when they get to this side, this is the bank of sterile instruments that are then available to be taken out into the treatment areas.
What's nice about this is it's just so transparent. There's nothing hidden.
Yeah, it's the idea. I mean, sure, there's a little bit of clutter. That's the sign of a busy practice. On this side, we used to have a dark room here many years ago when we weren't digital X-ray. In other words, we had to develop our films, and we've used this as a storage area for supplies for the rooms, gloves, things like that. So this is our central storage area, and you'll see a couple of other things. This is a spore testing device, which I point that out only because the newest sterilization guidelines in Ontario for dentistry, we actually have to test our sterilizer function every single day.
Wow,
and
great.